Hi all, I'm Dr. Ashwini. I'm based out of Bangalore and I'm a Ayush certified doctor and a proud featured wellness coach with Wellness Quotient community. And I have been practicing for more than 15 years now. And today, I'm going to talk about one of the secret about weight loss. So before that, I just want to know from all of you that, how many of you think that, doing exercise and following good diet can only help you to lose weight. So whenever I talk to people, I come across, they say that okay, I have joined gym and I have been following the good diet, but I don't see weight loss. So we will discuss more about it. Let me just share my screen. 1 minute. Yeah, is it visible? Yeah. So if we see, it's weight loss is not only about calorie deficit or physical activity, or beyond that we think that okay, genetics is playing role where I'm putting on weight, or some certain kind of diseases or medication. If you are taking depression or anxiety medication, we think that okay, weight loss is not happening. Okay, but there are more things to it which are like which are hormones, which are playing role here, and these are the metabolic hormones majorly playing role. Don't worry, I'm not going to talk everything here. Okay, but I'll give you a few basic understanding about what are these hormones and how they are playing role, or what are the signs you might be seeing in your body, which can help you to understand a little bit about what is happening inside. Okay, so we'll talk about first and the monster hormone. You must have heard about it on the social media a lot. Insulin, right? So insulin is the hormone which is do you know that in our body there are changes keep on happening for minimum 3 to 5 years before you develop this condition, called insulin resistance. So see, if you see, our body has a great mechanism to prevent things, but still if we are not working on our lifestyle and all, then we develop these signs. So what are these? You will see that you are not able to lose belly fat, or there is a pigmentation, especially around your neck area. This is called acanthosis nigricans, skin tags, or feeling tired, especially after meals. And having when we see in blood reports, we'll see that high HbA1c or fatty liver. So these are the a few signs of insulin resistance. So I'll just share you few hormonal signs first, and then we'll talk how to work on it. The other one is leptin hormone. Okay, so this hormone, what it does in our body, it helps our brain to understand that we are full. How do you know that you are full? Okay, so this hormone plays that role. So, and what happens exactly if you are not able to understand? Many times it happens with us, right, that we keep on eating, binge eating, uncontrolled eating, and we think that okay, why it is happening, we get into guilt mode, right? But this is the hormone which is playing a role in the background. Okay, where you are not able to control eating, or especially you feel that there is an increased cravings. Okay, and this happens because if you are someone who is having disturbed sleep for prolonged period of time, or if your inflammatory markers on a higher side, this hormone can go imbalance. Okay, the next one, very famous nowadays on Instagram, you must have seen lot of reels about it. And many people, again, they came to me and they were like, how to identify whether I have cortisol imbalance, or what can I do to work on cortisol imbalance. So first you need to understand what are the signs your body will give when you have cortisol imbalance. Especially you will wake up in between in the night around 2 or 3 a.m. Okay, you will see that you have lot of puffiness or swollen face. Okay, and even belly fat is one of the reason. It can be because of cortisol hormone. Feeling anxious, you are somebody who think अभी ये हो गया, उसके बाद ये करना है, उसके बाद वो करना है. There is always things are running in your mind, you are not able to control that. Okay, and other than this, feeling tired after waking up, in the morning, when you slept whole night, but still you feel like, I haven't rested enough. So these are the few signs your body will give you when there is a cortisol imbalance. Okay. Yeah. So this we all are familiar, right? Thyroid imbalance, and it is very, very, lot of people are suffering with this imbalance. And the sad part, being a doctor, I'll tell you that, in India, there are many labs or even doctors don't know what are tests we should do it to know exactly whether, there is thyroid imbalance or not. Because many times people come and they say that, I have my thyroid report normal, but I still feel, that these signs I have, especially dry skin, hair fall, feeling cold when others are not feeling cold, and slow heart rate, weakness, always fatigue or tired, So usually what happens is, we need to do a few deeper level tests where you have to do ultra sensitive TSH or free T3, free T4, even understanding antibodies, thyroid antibodies is very, very important. Doing only TSH, T3, T4 no, doesn't help. We have to do ultra sensitive tests for this. Okay. Yeah, so females, right? We are the we are the pity people because we feel, that we don't lose weight faster. Men can lose weight really fast. So there is a one major hormone, which is playing role here called, estrogen. Okay, so what are the signs? One can notice if they have estrogen dominance. Especially heavy periods, period flow will be on higher side. Always bloating will be there. So periods are painful, okay, and fibroids or polyps, this kind of growths, especially we see in our body. This is because of estrogen dominance or even infertility. This can be the signs which, ladies will notice if they have estrogen dominance. And what happens is once estrogen is dominant, progesterone can go low, and this imbalance will not allow you to lose weight. So that is the main reason. When it comes to male, there will be a testosterone imbalance. Because of that, what happens is, even though they train hard, they are not able to put muscles. Muscle mass is not increasing, or they see that, osteoporosis or high cholesterol. These are the few signs men will notice when they have, low imbalanced testosterone levels. Okay. So okay, so why we need to, look at hormonal imbalance, or if we see, why it is happening nowadays, what is the reason behind it, so if you see, there is a main factor which is playing role here is one is our lifestyle. If we see nowadays our lifestyle has become very unhealthy, right? We eat diet which is, many times we are not able to balance our diet because of the we have busy schedule, or I have seen people either they do too much exercise or they don't do exercise only. There are people who want to train themselves 2 hours 3 hours in gym and then go for walk also, thinking that okay, if I work out more, I'll see the weight loss. Okay. So that is one thing. Again, lack of quality sleep. We are we have been compromising a lot on, sleep quality, and excessive alcohol intake, or we see that nowadays most of the people have gut issues. That is another reason why hormones can go, out of balance, or a sluggish liver, like we heard earlier, right? That fatty liver has been, coming very early age. Okay. And excessive inflammatory changes in body. This is another reason why hormones can get imbalanced. Okay. uh, Apart from this, there are some factors which are, like, contributed by environment, like heavy metal exposures, through people who eat fish and all. They know nowadays like toxicity and all is becoming high, or even the beauty products whatever we are using, right? So every day we apply these products on our skin, and through that lot of toxins are going inside our body. And other practices like smoking or usage of plastic bags, non-stick utensils. So these all things are, contributing to hormonal imbalance. And nutritional deficiencies. They see nowadays, every home has somebody who have vitamin B deficiency, vitamin D deficiency. So these are the deficiencies have been very common nowadays, right? So do you know that, if you are someone who is having constant low iron, then you may have, thyroid imbalance, because, iron plays a very important role in, managing your thyroid hormone actually. Okay. Okay, so why we should understand all this, or what is the importance? I have been telling you all the signs and symptoms, but why we need to look at these things, and how it is related to weight loss. So let me give you few examples and perspective to it. Okay, so if you are someone who is who think that, okay, when you see reels on Instagram, right? You think that, okay, this hormone, I might have imbalance of this hormone, for example, cortisol, right? So I'll tell you, it it is true, or it is may not be true also, because you may have multiple hormonal imbalances. You may have cortisol and insulin together, which are contributing to your weight, not able to lose weight, or you may have thyroid and other hormone combination. Okay, so I'll just give you another perspective, right? So I see a lot of people, they think that, okay, let me follow high protein diet and do exercise, and I'll be able to, see much difference. I'll be able to lose weight. But I'll tell you things like, if you have high inflammatory markers and if you are following high protein diet, it can worsen your situations. So, following only high protein diet formula doesn't work for everybody. Second condition, if you have insulin resistance and fatty liver, again, if you're following high protein diet, you will see a lot of digestive issues and problems. So first, working on fatty liver with the right protocol, and then going for high protein diet, will make sense. So these are the few things. And even, many times I see people, they see about insulin resistance, that we should follow intermittent fasting for reducing insulin resistance, right? Yeah, that is true, we should do that. But do you know that if you have high cortisol levels and insulin resistance together, you won't be able to do fasting for a very long period of time. You will feel anxious. So you need a proper, see, it's not that it's like one cloth doesn't fit to all, right? Similarly, it's not possible that one protocol can fit all and will be able to see the weight loss, right? So it is really important for you to reach out to person who has invited you here, and understand, okay, what are the hormones which are creating imbalance in me, and how can I work on it. That will be the right way to help your hormones. And apart from this, let me share few tips on how you can keep your hormones healthy, so that you will not end up in this situation. Okay, so first and very important thing nowadays, what is happening is, we start our day with tea or coffee. That is the worst habit which can disturb your hormone. Okay, secondly, you have to at least you try not like a too much gap in between meals, but minimum 10 to 12 hours of gap between your dinner and first meal in the morning can help you to maintain your hormone health again. Okay, try and do moderate level exercises, not like a too intense workouts, or not very less activity. And also make sure that you are following proper warm up and cool down for your exercise routine, because that can help you to improve your growth hormones, which are again one of the hormone which is playing role here. Okay, and also make sure that you are not sitting more than 40 minutes at one stage. So make sure you are getting up and doing some walks, which will help you for your improving your insulin sensitivity, and working on your cortisol levels, improving on sleep quality. So nowadays, this is what happens, right? That okay, my day was very busy, and I couldn't relax myself, so I want to watch reels before going to bed, or we want to make ourselves comfortable. So that is one of the bad practice which can disturb your hormones. So make sure you're not watching your mobile before going to bed and after waking first thing in the morning. So these practices you should strictly avoid. This will help you to balance your cortisol levels. Okay, and stress management. So if you are someone who feel that you want to maintain your cortisol levels really well, then you need to understand understand that cortisol is the only hormone which goes high as we age. All other hormones may start going down, but cortisol goes high, and that's why we see that as we age, the disturbance in mind happens more. So if you want to control your mind and work on your mind, then you have to start, yoga and meditation practices at the middle age only, so that you will be able to, work on your mind in a better way. Okay. And apart from this, try and avoid using toxic products at your home. Use as much as organic, and try to shift your utensils to high grade surgical steel utensils, because that is something again contributes a lot. Okay. And plan for sun exposure for at least more than 15 minutes a day. Okay. So these are the few things, if you do, you will be able to maintain your hormonal health. And it'll be, if you feel that okay, this is something a little confusing for me, I'm not able to understand, definitely you reach out to your coach and they will help you. With this, I'm done, and back to Vishal.